Dr. Tarab Rai from Franklin.DentalCare and Dentures here. I wanted to talk to you guys about emergency treatment today because a lot of people have been wondering, hey, why is it that my teeth are hurting? Why is it that things are not going exactly the way that I want them to? Am I predisposed to having teeth that are worse than other people's? And I'm here to dissolve some of these myths. So, yes, there is a tendency for those that have genetic inheritance, where we have parents or grandparents or brothers or sisters that have weak enamel or have the outer layer not as mineralized to have dental problems. The vast majority of people, however, do not fall in this category. I will also say that if you had a lot of cavities at the age of 4 years old, chances are you're going to have a lot of cavities growing up. And that's a study done that dedicated the effects of eating a lot and the effects of essentially cavities and periodontal disease to be correlated with the bacterial composition in our mouths. So that doesn't change that much over the course of our lives. It does change probably on the habits that we have, the things that we eat, the people that we decide to spend our relationship time with. And the whole tendency to have problems with dental care at childhood generally tend to relate with a tendency to have problems with dental care in the future. So if you knew you had a lot of fillings when you were young, if you knew you lost teeth, or if you knew that there were dental issues, not placing the jaws and ortho, meaning teeth movement, but those other things, then it's your paramount responsibility to start taking care of your mouth more than perhaps other people do consistently. Now, when it comes down to a dental emergency, the questions that I usually go through with my patients are quite simple. First and foremost, are you in pain? If the answer is yes, okay. What type of pain is it? Now, the types of pain can be throbbing, it can be something that's sharp only sometimes, it can be a dull kind of ache over time. So all of these are indicators that there is something wrong with the tooth. Now, there's a variety of different things that can be wrong with the tooth, so then my follow-up question is, okay, what causes this pain? And usually people say to me something, they either say, okay, it hurts when I'm biting, they either say it hurts when it's hot and cold, or they say that it hurts all the time just randomly, which in dentistry is called spontaneous pain. And spontaneous pain that wakes you up in the middle of the night is a firm indicator that the pulp in one of your teeth has been infected. Now, what does that mean? That means that the bacteria has invaded the outer shell of the tooth, has gone through the dentin, and has ended up hitting that pulp chamber, which is where we get all of our sensation from when it comes to our teeth. So when bacteria get to that point, it's paramount that we deal with that. That is a true dental emergency, because that can lead to larger infections in the bone at the root of a tooth. It can lead to issues where these bacteria are moving into your bloodstream and going into your heart or into your brain. It can lead to issues where they get to the central spot right here in your face, and they can cause real big issues for you down the line. So I always say to people that if you are at that level of pain, to get it resolved as quickly as possible, because there's a drastic change in lifestyle that follows, right? So if you can't go to sleep at night, if you randomly are feeling like someone is punching you in the face or jabbing you with something sharp in your face, I don't see that being a reasonable mental state to make any decisions in, to actually follow through with responsibilities in life. So I say, whenever you can, if that situation is arising, go and get it dealt with. And there's a couple different ways. It all depends on the amount of decay, the amount of bacteria that have invaded your tooth. But if it's a small infection that's going directly to the pulp chamber, chances are you can get a root canal. Root canals are basically, we take out the soft nerve tissue of a tooth and we replace it with some inert material. On an x-ray, the center line of a tooth looks white after we finish a root canal. The philosophy behind a root canal is basically if we get rid of where the bacteria have infected and the part that essentially gives the tooth sensation, then we can eliminate that infection source so that you can go back to normal function. And a root canal done well will last you the entirety of your life. A root canal, however, tends to make teeth a lot more brittle. If you lose blood supply to something living, then that thing is no longer living, and it necessarily doesn't have that rejuvenation that the body gives things that it gives blood supply to. That means your tooth will get brittle over time. A brittle tooth means that if you bite on something hard over 5 years, 10 years, you might end up breaking that tooth. So whenever you get a root canal, it is very, very, very important to get a crown on it. So that's a porcelain ceramic thing that basically we take away the enamel layer of a tooth and put that porcelain ceramic thing to hold the entire thing together, the crown of the tooth together. When done well, that can last the entire life. The other alternative to a large infection that is leading to spontaneous pain is an extraction. And an extraction, what it entails is usually patients come in, we give them topical anesthetic. In about a minute, it makes you feel like you can't really feel the gum or tissue in your mouth. Then we give the following anesthetic, and then there's a little bit of tooth movement. I always say to patients, if you feel pressure, that's entirely normal. Pressure and pain, the difference between pressure and pain is when I do this with pressure and when I step away, it goes away. The sensation goes away altogether. If it's pain, like a cut, if I give someone a cut over time and I step away, that cut's still gonna hurt. So that's the two discrepancies. I'm telling you, if you are in emergency, if you are in pain, that it's a lot worse in your head. Getting the issue resolved takes you about 15 minutes of your life and maybe a chunk of change, but it will drastically change your quality of life when you get that resolved. It will give you a sense that you can actually put things together and actually take care of the responsibilities that you have that are larger than that one tooth. If you have any questions, leave them in the comments below about emergency treatment, about Franklin Dental Care and dentures, about the things that we do. No problem at all. My name is Dr. Tarab Rai from Franklin Dental Care and Dentures. I hope to serve you soon. You take care of yourself, okay? Peace.